So we want to start our session today. We have people in the room. We have people who are connected online. Apologies for the delay, but hopefully we'll catch up with time as we progress. So before we start, you may have noticed that you have name tags. And in your name tags, for participants who are here, there's a question, ask me about dash. So we would like to make networking a continuous process throughout this workshop. So you can be two different people today and tomorrow. So like mine will read, ask me about health effects of air pollution. Feel free to play around with, what you would like to convey to participants. If it's within the air pollution realm, well and good. If it's not, even better. So we can get to know each other beyond, what we do on a day-to-day basis. So that's an effort to sort of have us network and, interact with people who we would normally not, have conversations with outside our normal realms of, expertise and work. Just some ground rules as we begin for participants who are connected online. This is in webinar format. You're on view-only mode. There will be a Q&A session. We'll try and monitor the activity online as well. I think we have a few participants who are connected already. You can upvote a question. Please do when you feel that it's going towards a topic that is of interest to the group. Do also talk to us if you're experiencing any difficulties. And the slides and videos will be shared in the coming weeks. That applies to both in workshop participants and those who are online. We'll make everything available on our website. And that will be the place where we'll have all the material for this workshop. The hashtag, if you're on social media, for the young folks in the room and the old as well, East Africa AirQo 2023. So you can share as we go along, photos, views, comments on the discussion online on Twitter. So I would like, first of all, to thank the planning committee, a group of very committed individuals with whom this workshop would not have been possible. And they helped us really put this together in the form of the agenda and the logistics and everything. And their names are on here. I won't go through them one by one. They know themselves. But thank you so much for your commitment, for your critique, for bearing with us as well as we, went through several postponements for this event. But here we are, and we thank you. We also would like to thank our funder, the Clean Air Fund, who has graciously supported this this workshop and some of HEI's work on the topic. So without further ado, I think my work here was to just introduce us to the workshop and what we'll do for the next 2 days. So this is essentially a scoping workshop. Day one is themed around, the evidence, the health evidence on air pollution. We'll get to hear from different people, where we are on the continent, where we are as East Africa. And we'll have a small group discussion in the afternoon to sort of go through what are the questions, what are we really thinking about, what are the priorities, what can we do, less about the gaps and challenges, more towards, what can we do in the short term, near term, and long term. Tomorrow we'll have a policy-oriented session. We'll get to hear from our EPAs, both in Kenya and Uganda, what they're doing on the topic in terms of, setting standards and doing, considerations on the health effects of air pollution in their decision making. And on Friday, we'll have a short half-day training session on health impact assessment. So you're very much welcome to stay with us throughout. And hopefully we'll get, this discussion going and build on what's already being done. I would like to, actually we should have started with this. To ask Selela maybe to start us off with a word of prayer as we go to the first session.
Mighty and everlasting Father, we come before you this morning. We want to bless your holy name. We thank you for the grace that you've given us, that you've managed this workshop to come to a fruition after all the planning that has been done. As we sit here, we don't take it for granted. We pray that as we gather here to steer the work of air quality, to better the public health and the environment, may you guide us, grant us wisdom for the next 3 days, that what we intend to achieve, we shall be able to because of you, my Father. We thank you as we pray for protection of all lives in this particular meeting, for we thank you in the name of the Father, the Son, and the Holy Spirit.
Thank you so much. So if you can just project the next slide. So I'm moving very fast in the interest of time, so we can start and hear from our two guest speakers on their opening remarks. Philip, if you're connected online, can you just say hi?
Good morning, Victor. Can you hear me?
Yeah, loud and clear. I don't know if you can increase the volume a little bit.
Is it better now?
Yeah, we can hear you. Thanks. So Dr. Philip Osano is the Center Director for SEI Africa. He was one of our co-conveners for this workshop. Yeah, and we see you now, Philip. Thanks. So he's going to give us some brief opening remarks. We'll switch this round because Maurice is on his way. And hopefully by the time, Philip, you're done, Maurice will be here and he'll give us some brief remarks. So Philip, over to you.
Thank you so much, Victor, and good morning to everyone attending the workshop. I'm really pleased to join you. Unfortunately, because of unavoidable reasons, I could not be there physically, although I would have wished to be there. Nevertheless, I think it's an honor and a privilege, of course, for the Stockholm Environment Institute to join Health Effects Institute and other partners in convening this workshop. I think the discussion on air pollution and health is coming at a time when there's so much attention being focused on this issue in Africa and particularly in East Africa. And I would like to congratulate, of course, the Health Effects Institute, Victor and your team for this timely meeting. Many of you may not know about Stockholm Environment Institute, so allow me to just give you a brief background. The Stockholm Environment Institute was founded in 1989, and it was founded as a legacy institution of the Stockholm Conference, which is actually the United Nations Conference on Human Environment. This conference was held in June in 1972 in the city of Stockholm, hosted by the government of Sweden. And this was the first time that the United Nations put on the agenda the issue of environment. And of course, some of the major outcomes of the conference are still defining environmental action, not just within the United Nations, but also outside the United Nations. I think between 1972 and now, which is about just 50 plus years, we have more than 500 or more multilateral environmental agreements on different fields on environment. And so we've seen this rise on global action on environment. Unfortunately, of course, we have not at the same time seen action. In fact, last year we did a report, a science report to review environmental action since 1972. And out of all the agreements that have been signed by governments, our scorecard suggested that less than 10% of all those agreements across all sectors of environment, including, of course, biodiversity, desertification, climate change, air pollution, and a range of other waste management, only just less than 10% have been implemented fully or have seen some action. So we actually have a 90% failure rate on addressing environment globally. And that's where we come in as Stockholm Environment Institute. We work on a range of issues, particularly touching on environment and development. And air pollution and climate change have been one of the core areas where we have been actively involved since 1989. The key mission that we deal with is actually to bridge science, policy, and practice And we do that by undertaking our own research work. We do a lot of air quality monitoring at the moment across Africa in partnership with UNEP. We have put together sensors in about 14, 15 countries, and we are continuing to do that. We have also supported countries in terms of integrated planning to address climate change and air pollution together. And we do this by availing a decision support tool called Low Emission Analysis Platform, which is being used by many countries in terms of their combined planning for both climate and air pollution. I just wanted Victor to point out, I think for the sake of the participants here and for the reflecting on what has been our experience, just 3 things which I think are important and I think which should be central to this workshop. The first one is that we see a serious disconnect between the community of practice that work on air pollution, particularly air pollution monitoring, air pollution enforcement and compliance, and the community that works on health, ministries of health, agencies that deal with health issues. And this disconnect is actually one of the opportunities that I see this workshop helping to fill that gap. In many cases, if you look at, and we have done that, if you look at, for example, national strategies for non-communicable diseases across many countries, you find that, of course, some of these strategies do consider environmental determinants of health, which is a range of them. And when you look at the consideration of environmental determinants of health, you just see pollution or air pollution as a very small component. Yet in practice, if you do go to look at, for example, maybe the data on health-related challenges that can be linked directly to air pollution, particularly upper respiratory illnesses, you actually see such a huge surge, particularly in African urban areas. So that disconnect is one area where I see this workshop helping to bridge that gap, bringing in researchers and practitioners that work on air quality generally, combining that together with those that work on health, particularly the medical profession. And this is something that we have started also at SEI to actively do by actively engaging medical practitioners, physicians, the Non-Communicable Disease Alliance community, just in terms of making sure that the data that is collected on the status of air quality is available to the physicians and medical community. I think on the policy side, we do have a framework, of course, that help us work on this. Most of you know the Libreville Declaration on Environment and Health, which was signed in 2008, and which actually requested that there's more collaboration between ministries and sectors that deal with environment and ministries and sectors that deal with health in Africa. So that is one area I just wanted to flag out, that it will be good to see some, not just recommendations, but some concrete actions and steps around really bridging this disconnect between the massive and growing air pollution evidence from research and data to the action and the burden that's felt on the health sector and the capacity needs for that integration. The second thing I wanted to point out, which is something that we've missed across the board, is the fact that for national governments and of course regional intergovernmental organizations, a lot of planning in Africa goes towards prioritizing development challenges. So most of the sectors that governments invest in, whether it's transport, whether it's energy, whether it's agriculture, are also source sectors for air pollution. And we have not, and when I say we, I'm talking about the air quality research community, we have not done a good job of quantifying the economic cost and economic burden on air pollution, particularly through studies that provide for cost-benefit analyses. In that way, governments and policymakers do not have appreciation on the cost of development, whether the investment that they make in transport, investment that are being made in agriculture, investment that are being made in energy, and so on. Because most of these, areas, including industrialization, which is a big agenda for Africa, come with a cost, with a large environmental footprint and environmental cost related to air pollution burden. And we've seen, for example, from the climate change aspect, that when we, together with partners, conducted studies on the economic cost of air pollution, we did this for East Africa, 3 countries, for Tanzania, for Rwanda and Kenya. It brought to the attention the policymakers in the finance sector, in the planning sector, paid more attention, of course, to the cost of climate change on the economy and economic growth. I think there's very little, just about a few evidence at the moment in terms of quantifying the actual cost, economic cost to on air pollution to development sectors across Africa. And without that, there will still be very little attention paid to investment in air pollution and addressing air pollution across the different source sectors. And that is actually something that is not helping, because air pollution is invisible. And as long as we can't connect the cost to the, particularly that's being shouldered by the health sector through mortality and morbidity, there'll be very little attention and very little support from policy making. So I wanted to just point out, because if we look at all the countries, particularly in East Africa, most countries now have set up their national development visions. East Africa Community itself, which has 7 countries now, as an East Africa Development Vision 2050. So really long-term planning to 2050. When I looked at that document, as I've done several times, it's about 170 pages. The word pollution is only mentioned 3 times. And it's mentioned in connection to the need for capacity that needs to be developed within the Secretariat. It's not really mentioned across the other sectors where priorities are identified. Of course, when we look at the Africa level, we do have Africa Agenda 2063, which was adopted by the African Union Commission in 2013, and which sets the development priorities for the continent. And again, if the development priorities outlined in Agenda 2063 do not take into account the burden on air pollution, it will likely sort of not be reached. So I wanted to say this because we, the Stockholm Environment Institute, together with African Union Commission, United Nations Environment Program, and the Climate and Clean Air Coalition, are just concluding the first integrated assessment on air pollution and climate for Africa. And within that integrated assessment, we actually have been able to identify 5 key areas where action needs to be taken. And across these 5 key areas, we point out 37 measures that need to be implemented at all levels, at city level, at national level, and within the continent, to be able, for the continent to be able to meet the vision and program identified for the Agenda 2063 in agriculture, in household energy management, in energy generation, in transport, and in waste management. And lastly, I just wanted to conclude that I think it would be good to discuss also the framework and collaborative arrangements that needs to exist between countries within particular regions. And for East Africa, where you're focusing on, we, as Stockholm Environment Institute, together of course with UNEP and other partners, were part of the organizations that helped support the development of the Regional Framework Agreement for Air Pollution for East Africa, which is signed by 11 countries, the popularly called Nairobi Agreement. Now, that agreement, that Regional Framework Agreement, of course, identified areas where there needs to be more collaboration between the countries in the region to address air pollution. And I think this workshop would be one possibility for starting to unpack how actual action within the different sectors would be realized. I say so because at the moment we are supporting the Minister of Environment in Kenya, together with Climate and Clean Air Coalition, to develop an action plan for short-lived climate pollutants. We're just starting a new project in Uganda to support the Ugandan government, develop an action plan for methane action. And we're supporting several cities, including Dar es Salaam, to set up baselines for air quality and air pollution data for supporting development of city air quality action plans. And of course, we have also been part of a group that supported Nairobi City County to develop City Air Quality Policy and Air Quality Act. So Victor wanted to point us 3 areas as part of issues that I think would benefit from further discussion from this workshop. Otherwise, I would like to take this opportunity, of course, to wish all of you a lively discussion, and I look forward to the recommendations and the action that are going to come out of the workshop. Thank you very much.
Thank you very much, Philip. Yeah, I'm audible. Thank you very much, Philip. I think the one thing you said that stuck with me is we are failing 90% on the environment side, not because of lack of frameworks and ways of doing things as a planet, as a globe, maybe lack of commitment. So thank you so much, Philip. We do wish you the best in your deliberations in Naivasha. Hopefully you can still stay with us for a little bit longer and maybe listen to the opening remarks from Nairobi County. But thank you very much. Always exciting to hear from you. And you set the stage for some of the discussion that will happen in this very workshop. So I thank you once more.
Thank you, Victor.
Thanks. In the interest of time, I would like to welcome Mr. Maurice Kavai, who's the Deputy Director, Climate Change and Air Quality for Nairobi County, to give some brief opening remarks. The floor is yours, Maurice. Karibu. And also to welcome us to the beautiful city of Nairobi.
Good morning, everyone. Good morning, everyone. Let me take this opportunity, first of all, to welcome each and everyone to this forum. I want to read my remarks so that then I also provide a soft copy for if we have any media team, they can be able to take it to the next level. The guests present, Nairobi City officials, leaders of key institutions, dignitaries, distinguished participants, all protocols observed. Nairobi City County Government is honored to have you all present, physically and virtually, to witness the launch of the Health Effects Workshop here in Sarova, Pan-Africa, Nairobi. Kenya's capital has experienced accelerated growth in both population and economic output in the last 2 decades, driven by its role as an international and regional hub for commerce, transport, regional cooperation, and economic development. Its population has increased from 1.4 million in the 1990s to more than 5 million in 2022, and is projected to grow more than 7 million by 2030. This rapid expansion has worsened the city's environmental footprint and worsened air pollution, which has increased by more than 180% compared to 1970 levels. Poor air quality is not evenly distributed and tends to be worse in the former settlements, where more than 70% of city residents reside, thus exacerbating inequalities in the city. Just to mention, vehicle emissions, open waste burning are among the top sources of pollution in Nairobi. Walking along busy highways is the most common mode of travel in the city, which leads to increased exposure to traffic exhaust. Informal food selling and businesses conducted along roadside also expose low-wage workers, particularly women, to elevated levels of pollution from nearby dam sites. Industrial activities and vehicle emissions are also key examples of where air pollution comes from. Inadequate housing, transportation, healthcare also further compound the impacts of poor air quality. City leaders have signed, they are committed to address development of a citywide air quality action plan and concurrently passing the Nairobi City County Air Quality Act. However, Nairobi now is on track on establishing a robust air quality monitoring framework to better understand and track pollution sources, thanks to our new partners. In the few long-term studies conducted in the city, particulate matter has been identified as a pollutant of concern with concentration exceeding the WHO limits. Nairobi faces several risks from climate variability, and that necessitates robust resilience and adaptation strategies. And the implementation of the actions outlined the Climate Action Plan. Due to the cross-cutting nature of the climate action to ensure good climate governance, there is a need for the city to continue mainstreaming Climate Action Plan throughout the city governance systems and structures across all sectors on board and departments involving in the delivering of the Climate Action Plan. Nairobi City County embarked on an ambitious journey in 2015 to tackle its every climate challenges and developed long-term actions aimed at ensuring sustainability, low carbon development, enhanced resilience, and improved livelihood for city residents. The support of partners, just to mention, the Ministry of Environment, the city also signed a vertical integration which ensures a climate action acceleration across board through all the sectors within the Ministry of Environment. NEMA, Stockholm Environment Institute, UN, C40 Cities World Resource Institute, AirQo, the Network on Air Quality Management Space, has promoted cross-learning, deep depth understanding of air pollution by establishing institutional frameworks, legal framework on air quality, that is the policy, the act, and the action plans, such as carrying of source, narrowing of emission, development of communication methodologies to address lay perception on air pollution, just to mention a few of what we have been able to do. All these resources have been able to enable the city create a pool of resources that, if properly utilized, can impact positively in the overall management of air quality. And now, while acknowledging the entry of the new partner, HEI, in this space, who I believe are going to sharpen our understanding on the global burden of air pollution in our communities, hence create both preventive and curative solutions which can be used by the medical fraternity to save further loss of human life. Improving of air quality management is an enabler of achieving transformative climate interventions to meet global and national obligations of the city-county government, thus making Nairobi a livable city. There are a total of 36 climate mitigation and adaptation actions. 15 of them are ready to implement actions across these sectors, and these actions will directly contribute to the implementation of Kenya nationally determined contribution. This process has been bearing fruit with the establishment of the climate change and air quality monitoring subsector within the Green Nairobi that aligns with the provision of the National Climate Act of 2016. Nairobi greatly appreciates this opportunity to share this great milestone, and we are looking forward for further engagements. Finally, I want to thank all of you for coming to this event, and also I would want to appreciate in advance your contribution and your presence throughout the process. And with those few remarks, with the powers bestowed to me by the Governor of Nairobi through the CEC of Green Nairobi, I declare this workshop open. Thank you so much.
Thank you so much, Maurice. So we have a license to operate. Don't leave just yet. So we have, the permission of the county to proceed with our deliberations. The one thing I like between, Maurice's talk and Philip's as well, we are talking a lot about integrated action. And for both cities, Kampala and, Nairobi, we are just starting that journey. It's a long journey. We've heard from the Nairobi side. Probably throughout the next few days, we'll hear on the Kampala side. It's a long journey, but we have to start somewhere. And we are seeing these things as connected rather than isolated. So without further ado, I would like to hand this over to one of our co-organizers, the Eastern Africa GEO Health Hub Kenya, Professor Nick Oguge, who is the principal investigator based at the University of Nairobi, to take us through the keynote session. Karibu.
Good morning once again. Okay, you don't look very motivated. Good morning. Good morning. Okay, thank you very much. Now we are getting to another very exciting session where we are going to listen to two keynote speeches around health effects of air pollution, giving the context, evidence, and policy applications. And we have two great presenters to help us through this. And I'll give 20 minutes to each of them to make their presentation. And then we'll have a general discussion whereby I'd like you to think about implications to where we are going, as suggested, of course, by Philip and also by Maurice Kavai. So I'd like to first call on Dr. Karadi Wright. And Dr. Wright is the Chief Specialist Scientist, Environment and Health Research Unit at the South African Medical Research Council. She has a PhD in public health and is a Chief Specialist Scientist at the South African Medical Research Council, leading the Climate Change and Health Research Program. Her expertise are in air pollution exposure and risk reduction, skin cancer prevention, and climate adaptation and interventions. Karadi has published more than 110 research articles in accredited journals and supervises postgraduate students at multiple institutions, having graduated more than 30 scholars at various postgraduate levels. She also serves on the Health Effects Institute Global Health Oversight Committee. Karadi, please welcome. And Karadi is going to talk to us about air pollution and health in Africa. Welcome.
Good morning, everybody, and thank you for the very kind introduction. It's wonderful to be with you all, and I'm looking forward to engaging with you in the next few days. So, by way of introduction, if we think about dirty water is a very visible health threat. But, as was mentioned earlier, air pollution is often not seen or even smelt, and yet it deals a potent blow to human health and to many parts of life itself. In Africa, we live in a context of contrasts. We are faced with inequity, inequality, and poverty, diagram illustrating the real differences that we see in many of our countries across the African continent. At the same time, we are on the path of a development trajectory, the Africa that we want, according to the African Union. And together we have to somehow find the synchronized co-benefits in trying to address many of these challenges, poverty especially, while embracing a development pathway for the continent. Agenda 2063, the Africa we want, is Africa's blueprint and master plan for transforming into a global powerhouse. It is our strategic framework that aims to deliver on its goals for inclusive and sustainable development and aligns very closely with the Sustainable Development Goals. But this we have to view in the context of an environmental health threat, particularly air pollution, from numerous different sources varying across our countries: power generation, domestic solid fuel burning, industry, vehicle emissions, and so on. And grappling with these brings up a really important concept, that of human rights. The right to clean air, and how complex this all is in trying to address these challenges. So, drawing on the State of Air Quality and Health Impacts in Africa, State of Global Air Initiative report, the Africa report is a powerful document together with an interactive website that draws together the evidence of air quality and health across the African continent. So this map is showing us that most people in Africa live where particulate matter, 2.5 micrograms per cubic meter, so very small particles that can penetrate deep into an individual's lungs, in many parts of the continent are much higher than the World Health Organization's air quality guideline for this pollutant, which is 5 micrograms per cubic meter. Several of these countries are in fact experiencing particulate matter levels greater than 35 micrograms per cubic meter. What do those numbers mean? So if we have a look at the latest World Health Organization air quality guidelines, there's a guideline value that we're striving for on the far right-hand side, and you can see there that it would be 5 micrograms per cubic meter for particulate matter 2.5. But the interim targets are the stepping stones for us to try and achieve that air quality guideline value. And interim target 1, which is the first target that many of us see our countries use as our national ambient air quality standard, is 35. So if we go back to the map, we can see those very dark red countries, colored countries, are way above, or you could be 35 or way above in terms of particulate matter. Just to mention that the WHO has identified the pollutants of concern, which all have received these air quality guideline values updated in 2021, I think. Was it 2022? I should remember that. It's 2021, September 2021. And the pollutants that we are concerned about: particulate matter, ozone, nitrogen dioxide, sulfur dioxide, and carbon monoxide. So this is a very busy table, but I'll break it down for you. Among these countries worst affected by PM2.5, few have national ambient air quality standards. These are the primary tool that we use to try and monitor air pollution in our countries and are really critical for air quality management. So those ticked with green, among these with the highest levels of particulate matter, are the only ones that have national ambient air quality standards. And all of these, again, exceed the least stringent interim target that I just showed of 35. If we consider the change over time in the population-weighted annual average PM2.5 exposure for the 5 countries of interest that are presented in this SOGA Africa report, we can see that there's been very little change, perhaps modest improvement in some of these countries. Of the 5 countries of focus, Kenya experienced the greatest improvement, with a 19% decrease in average PM2.5 levels overall. But typically these lines are looking quite flat, which means we've got a lot of work still to do to try and reduce PM2.5. Air pollution comes from a variety of different sources. So this plot is showing us the contribution of key sources to PM2.5 exposure from 2019 for the 5 key countries of focus in this particular report. And we can see that there are both anthropogenic, so human-made pollution sources, and also natural sources of air pollution. The natural ones would be things like wind-blown dust. This is a critical problem across the African continent, both from unpaved roads and from open veldt or fields. It also includes wildfires and sea spray. And then the human-made sources would be things like fossil fuel and biofuel combustion, transport, and industrial, agricultural sources, as well as waste burning. Desert dust and household solid fuel are both important in this context too. We have to consider the different sectors that contribute towards PM2.5, and there are significant differences across countries. For example, in the Democratic Republic of Congo and Kenya, energy production, you can see from the plot, only contributes about 2% towards the total PM2.5 concentrations. However, in South Africa, where I'm from, the energy production contributes 23% of our ambient PM2.5, and this is because we rely on coal-fired power stations. Then another important source is household air pollution. So looking at this, as of 2019, the proportion of households using solid fuels for cooking in Africa was highest in Eastern Africa, Western Africa, and Central Africa. The lowest proportions were in Southern Africa and Northern Africa. In countries with the highest proportion of household cooking using solid fuels, this is Tanzania and Uganda, including Tanzania and Uganda, for example, more than 97% of the population were relying on solid fuels for cooking purposes, especially. And it is against this backdrop that it is clear that air pollution is a climate and health emergency in Africa, as well as globally. If we turn now to the effects of air pollution on human health, just 3 slides to give the background to this. We can think of it as a pyramid of effects. So the proportion of the population affected will vary. So the less complicated or severe effects affect more of the population. But as we go up, the magnitude of impact increases. So the severity of the effect is worse, with the top worst effect obviously being death. And the magnitude of impacts affecting from millions, for example, with respiratory illnesses or aggravated asthma, to ER visits, as well as hospital admissions, and then unfortunately things like heart attacks. And so we can see that there are a number of people likely across the African continent who are experiencing things like lung function decrements, inflammation, which is something we've realized is caused from air pollution exposure, and cardiac effects. So air pollution affects people from the very beginning of life, when an embryo is formed within the womb, and until the end of life. So when a person is elderly, and especially somebody who has a pre-existing chronic disease. Almost all organ systems and processes in the human body may be impacted by air pollution. The lungs, heart, brain, vascular system, your metabolism, and reproduction systems are all affected. We can then think about how these impacts are defined by the nature of the exposure to the air pollution. It's sort of similar to thinking about acute or chronic effects. So some of the short-term exposures to air pollution include a range of diseases. Some I've mentioned. We could also think about ear, nose, and throat irritation, difficulties breathing, chronic obstructive pulmonary disease, and heart attacks among people with heart disease. The longer-term exposures would be things like preterm birth and low birth weight. That's where the mum has been exposed, but the fetus has been subsequently exposed. Trachea, bronchus, and lung cancers. And it's important to note that the International Agency for Research on Cancer, IARC, has actually classified PM2.5 as carcinogenic. Cataract is also a common unfortunate event from exposure to household air pollutants, particularly among women, type 2 diabetes, and then the mental health consequences of air pollution exposure, including things like dementia. There's another layer we need to consider here, and this is the complexities associated with certain vulnerabilities. And I've mentioned some of these already, but unborn children, infants, children under 5 are all very susceptible or vulnerable to the impacts of air pollution, as are pregnant women, the elderly, people with pre-existing diseases, and minority groups who are often in the zones where air pollution is worst. If we turn then to what are some of the impacts that we know. So here we've got the number of deaths attributable to air pollution in 2019. The air pollution is considered to have accounted for around 7 million deaths annually every year based on 2019 estimates. And not only does it cause certain diseases, but it also exacerbates certain diseases. Air pollution contributed in Africa to 1.1 million deaths. And of these, 63% were likely related to exposure to household air pollution. A huge area of concern that we do need to address. In sub-Saharan Africa, if we look at death rates, the death rate is approximately 155 people per 100,000, which is almost double the global average of 85 people per 100,000. And in 2019, PM2.5 and household air pollution were the leading risk factors for deaths across the region. The disease burden for PM2.5 is highest in Northern Africa and lowest in Central and Eastern Africa. And if we look at the table on the right, the total number of deaths help us to see the most number of people affected. So it's not necessarily a standardized age rate, but the total number of people. And here we can see that Egypt has the highest total number of deaths in relation to particulate matter, PM2.5. Similarly, in this table, we can look at the top 10 countries with the highest number of deaths linked to household air pollution in Africa in 2019. And here we see about 130,000 total number of deaths in Nigeria. I'm almost done. So a recent study using the World Health Organization Global Health Observatory data, as well as the 2019 Global Burden of Disease data, considered 30-year trends in deaths attributable to communicable and non-communicable diseases. So what's interesting to look at here is there seems to be a decline in the communicable or infectious diseases over this 30-year period. However, there is a very steady gradient of an increase for our non-communicable diseases, and this would include things like cardiovascular disease and cancers. On the right-hand side, we can see the deaths attributable to household air pollution. And I've already mentioned that this is an area that we really do need to address. It's air pollution in the breathing zone, especially among women and children. So if we turn then to how can we think about these for our own countries, where can we find the data to try and understand the impact of air pollution on human health in our environments? There are a number of different data sources that one can look at, and I've mentioned some of these here, including the Global Burden of Disease work, the Health Effects Institute website, WHO's observatory. Then there's country networks. AirQo has some excellent data too, and then satellite data. And just to mention that there's going to be an air quality monitoring in Africa webinar coming up in April. Here is an example from the Health Effects Institute, State of Global Air. So here's an air pollution and health fact sheet. You can obtain this for your country and get a very good sense of what's going on in terms of air pollution and health. And finally, I was part of a 5 academies exercise to bring together a call to action around air pollution and health around the world. There was a motivation to adopt a global compact on air pollution. And what I really appreciated amongst all the advice that was put out in this particular report was that we should try and share our stories, especially those that have been successful in controlling air pollution. The more that we learn from each other, the more likely we are likely to make change. And finally, I would just like to acknowledge the Health Effects Institute and all of the sponsors of the meeting, as well as my own institution, for allowing me to be here. Thanks for listening.
Thank you very much, Karadi. I think maybe before you step down, we can perhaps take a couple of burning questions, maybe just two, in case there is any. There'll be time for discussions a little later at the end of this session, but if there are any burning question? Okay, there isn't, so it's, oh, sorry.
I'm Josephine Anasazi Muramata from KCCA, that is Kampala. Can you take me back shortly on vulnerable groups?
Yes, so vulnerable groups are groups that have been identified that are particularly susceptible to the impacts of air pollution. So do you want me to go back to that slide? Yeah, okay. And the reason why they are particularly susceptible is either because there's a physiological reason, so children who are still developing have higher breathing rates, so they're inhaling more air pollution relative to a small body mass, which means that that pollution can have a greater effect on their body. Many of the others are just by way of easiest explaining, is that they can't necessarily control their exposures. So if a child is in a, let's think of a child care setting, a child can't know that this is there's an air pollution problem here and try and prevent their exposure. The same for elderly people. If somebody is in a home for the elderly, they can't move themselves somewhere else so that they can reduce that exposure. So there's a level of helplessness. So there's two aspects. The physiological, for example, the children who breathe more air relative to their body, and then the other is which is more kind of behavioral or place-bound, where somebody is exposed to levels that they can't control themselves.
Thank you very much. Karidi, we'll get back to you during the discussions. Oh, okay, there is another burning question. Okay, we'll take that and then we move on to that.
Thank you. So,
I'll try.
okay, so my question was, why does North Africa experience higher levels of PM particulate matter compared to the other region?
Yeah, so I'm probably not an expert on that, but I have a suspicion that it might be around the desert dust. I think that would be one of the most important natural sources. But I'm sure there are more experts in the room who would be able to add.
Thank you.
Yeah. So hopefully we'll be able to address that during the general discussion. Okay, in case you're online, please just keep your question and we'll ask them to the presenters during the general discussion. So I'd like now to introduce Mr. Robert O'Keefe, who has served as Vice President of Health Effects Institute for over 2 decades. Robert provides leadership for the Institute's major programs, including core, global, and energy, and leads the Institute's engagement with the US Congress and other domestic and international regulatory bodies. Now, prior to joining Health Effects Institute, he served as Assistant Deputy Commissioner for Policy and Programs at the Massachusetts Department of Environmental Protection. Bob served as a member of the U.S. Environmental Protection Agency, Clean Air Act Advisory Committee, and Mobile Sources Technical Review Subcommittee, and is Chair Emeritus of the Board of Clean Air Asia. And Bob, welcome Bob to come and talk to us about role of impartial science in effective air quality policymaking. Bob.
Thank you. Good morning and welcome. It's great. I love the good mornings. Thanks for being here, and thank you very much to our co-sponsors, to the co-chair of our session. And I have to say it's a great privilege to be back in Kenya and in Eastern Africa to work with you and learn from you about the many steps that we can take together to reduce air pollution and associated health impacts. I'm going to follow, and I also should say thank you to the co-sponsors of our session, who we worked very hard with, as well as our advisory committee. So we appreciate that. We'll talk today about setting air quality standards and the role of air pollution and health research in informing air quality action. This is a talk that's designed to complement Karity's talk about health impacts in Africa specifically, and fill in a little bit about how the evidence that's used in setting actual ambient air quality standards around the world that's relevant, I think, to settings here. And to do that, I'll refer periodically to this chart from the U.S. National Academy of Sciences report on air quality management, and it outlines some of the basic steps. And this is a very short talk for a very long process that can last several years in terms of reviewing the science. But this chart's pretty useful, I think. It covers first setting standards and objectives, designing and implementing control strategies, and measuring progress, something that's often overlooked, but is really critical in terms of air quality management. So the first question is, in setting an air quality standard, is identifying whether there's a health hazard from exposure to air pollution. And we just heard from Karity about the significant health impacts of air pollution in Africa, and certainly those exist in other parts of the world. But this is essentially the first question in setting a standard. And many forms or types of studies are useful in setting these standards. And the first are daily time series studies or population studies that examine the relationship between air pollution and health when air pollution goes up or down on a particular day in often acute events. And that's especially useful for setting a 24-hour standard for air pollution. The second type of studies or grouping of studies that are quite important in this process are studies of long-term effects, cohort studies, panel studies that examine how exposures do or don't affect a particular population, but over an extended period of time through long exposure to air pollution. And these types of studies are especially useful in setting ambient long-term standards. An annual standard for particulate matter, for instance, is one example. And I will focus a little bit more on PM in this talk just for the sake of time. It certainly is relevant to other pollutants as well. One example of evidence that's used to set long-term standards is this meta-analysis. It's a recent global study of mortality and its impacts that provides, I think, fairly consistent evidence across the board of the long-term effects of air pollution. These are studies, the authors are on the left, and I apologize, it's a hard-to-read chart, but the studies are conducted in Canada, the United States, and a couple in China. And what it does is assesses the long-term exposures to air pollution in different groups. The second column are groups, and they're groups of elderly, groups of teachers, groups of Chinese men, and other cohorts that are followed over an extended period of time, looking at different factors in their life that could also mitigate impacts, but also their exposures. The chart on the right shows the no-effect line and where the studies end up in relationship to the no-effect line, and we find a consistently positive and statistically significant effects for exposure to PM 2.5 and all-cause mortality in the large majority of studies. Overall, this analysis found about an 8% risk in mortality for each 10 micrograms of exposure to PM 2.5. So it's a fairly high level of impact, and that's really the first step in identifying a hazard from air pollution that is at the baseline of setting a particularly long-term standard. The second question is at what exposure level do effects occur from pollutants? And this requires evidence of a concentration-response relationship, which is obscured by my picture, unfortunately. It's basically the level of air pollution associated with a specific health impact. And to understand that, we need information about exposures across these populations that are being studied, and the health status and outcomes in that population, whether, as Kennedy mentioned, it's lung cancer incidence or different types of mortality, many different endpoints, and the level, of course, at which they occur. And this draws on a large worldwide data set, but there are gaps remaining in Africa that need to be filled going forward, I think, in order to make sound decisions. One example, a specific example of a concentration response relationship study is this really interesting paper from Liu et al., and I believe Kennedy was a co-author of this study, as many other studies, in the New England Journal of Medicine. And it looked at daily time series studies, as I mentioned, about air pollution going up or down on a particular day, and health impacts in 652 cities across 24 countries, some of these including Africa and China and Latin America. And it found, one of the findings of this before I get to the concentration response relationship, were strong associations of mortality with levels of air quality that were below the then US standards and the WHO standards. And the WHO standards have since been strengthened, and the US standard will be strengthened. I'll talk about that in a minute. But that was a very key finding in terms of driving regulators to think again about where to set a standard. And in terms of concentration response relationships, this nice graph depicts daily mortality on the left and PM 2.5 levels on the right. And you can see plotted against WHO interim guidelines, 2, 3 in the US NAAQS, US National Ambient Air Quality Standard, and you can see the health impact at different levels of exposure for these different regulatory thresholds. And in that sense, it's very useful for understanding the practical application of a concentration response. So I'll move on to using evidence to set air quality standards and guidelines. And I'll start with just a quick overview. Kennedy mentioned the situation in Africa, but stepping back a little bit, a quick review of the current PM 2.5 standards. There's others, as I mentioned, across some key countries. The first is the PM 2.5 annual standard. Kennedy mentioned 5 is a very stringent, frankly, WHO standard or guideline with also reduced interim targets. The United States has been at 12 for a number of years. They've just concluded a major review of the US PM 2.5 standard, and they're expected to propose somewhere between 10 and 12 based on the latest scientific evidence. The European Union has been at 25 for a while, and they've just gone through an exercise relying very heavily on the WHO guideline information, and they are proposing a level of 10. And India is just starting a review of not only PM, but all of their ambient air quality standards. It's at 40, and we'll see where that ends up. So it's a very active and dynamic field. It's a question that gets revisited as evidence moves in and we understand more about air pollution and health. And so we look again to see whether the current standards are protective or not. Certainly, many of those studies are underway. Those evaluations are underway in individual countries. But it's fair to say that the global benchmark for setting national ambient air qualities are the WHO air quality guidelines, which were mentioned earlier. So just in brief, in one slide, what are these guidelines? These are health-based guidelines, and they're based on extensive scientific evidence in groups led by scientific panels. John Samet was one of those. Kennedy was one of the people who were involved in setting the WHO air quality guidelines. So you can direct your complaints to them if you have any as the day goes forward. But these are levels that are necessary of quality, of ensuring the quality of air pollution to protect public health. That's the goal of these guidelines. They are recommendations on air quality levels. They're not standards. And they provide, as we mentioned, both final and interim targets for a whole range of pollutants. And the guidelines are designed to communicate to policymakers who need to set a standard at the national level where there's legally binding ability to enforce standards and goals. And as I mentioned, the EU really relied quite a lot on the WHO air quality standards to set guidelines for all of Europe. So these are really key in some parts of the world. Although, as I also mentioned, different countries have their own processes. The US uses a Clean Air Act Science Advisory Panel of scientists who review standards and review evidence and set standards there. China, for its part, earlier chose an interim target. They did not choose to go to what was then the tightest level. They're at 35 micrograms per cubic meter for PM 2.5 across the top. And I think this goes to the big message that air quality management is a long-term commitment. There are no shortcuts to this. It's been seen in every part of the world. The United States and Europe started in the 1950s. They're still working at it. So an interim target makes a lot of sense. It's an achievable milestone. And frankly, it avoids countries being in a position to dismiss stringent targets. It's just simply out of reach or unreasonable. Charity mentioned this. In Africa, the number of countries who don't have even one air quality standard. But my message here is that Africa is not alone. Some of the Americas have 30% of the countries there without air quality standards, without even one. And the Western Pacific is another area where there's a lot of work to be done that remains to identify new air quality standards to begin making progress. So we're all in this together. The good news is that there's growing evidence of air pollution and health in East Africa. This is data from an interactive database maintained by the Health Effects Institute that now includes over 80 studies of air pollution in an interactive database that tracks studies by type, by author, by location, and you can click on the individual studies to see the available evidence. It can be found at the website along the bottom, and it's updated regularly by HEI, so we will try to keep this current. These studies and the whole issue around local evidence is really key to setting national standards at the end of the day. There's a very large and robust global body of evidence, but it's important to inform extrapolation from that global body of evidence to local conditions, and local studies help do that. They also understand in a much more fine-grained manner what the levels are in different countries and different cities. And frankly, and I get a little biased here, they're really valuable for convincing both politicians and the public that air pollution effects that are observed at the international level are real and manifested in constituencies and in families. How can we test which sources contribute to air pollution? And we use those to set priorities for air quality management. And this requires source-specific estimates of emissions and the populations that are or not exposed to the sources as the first step before health considerations are added. This is very challenging in high pollution environments, especially where there are many sources and so many people are exposed. And air quality monitors, as we've heard from our friends at the Stockholm Environment Institute and others, are really limited. So identifying source contributions is really critical to putting in place effective air quality management plans that protect public health. One example of this activity, looking at source-specific burdens of major air pollution sources, is HEI's GBD project, or Global Burden of Disease from Major Air Pollution Sources. And this is a global database that was constructed by HEI and teams of scientists in cooperation with the Institute for Health Metrics and Evaluation, and they track sources and sectors that contribute most to air pollution and their health impacts worldwide. Again, they rely on air quality monitors, satellite data, and models, and often there's an absence of local data. So this is a place to start. It's not a place to end, and to begin to identify effective approaches to air quality management. And the chart on the right is a chart of the different sources, whether it be household, industry, or transport, in the WHO air quality regions, and that can be broken down by country if desired. So the last step in setting ambient air quality standards is the implementation of control measures. The first two steps were setting standards and implementation of control measures. And this is really a slide that goes to the importance of measuring progress, both in levels of air pollution, which is just basic air quality monitoring, but also assessing whether health impacts have improved due to the steps that have been taken, the regulatory actions that have been put in place by governments and others. And one example, and my last example, of a study designed to measure progress by regulatory measures is this really nice study of the health impact of China's Air Pollution Prevention and Control Action Plan. It was it was a suite of some 10 measures, very stringent across the entire country, that began in 2013, 2014, and it looked to reduce emissions from coal burning certainly, but also from energy production, transport, and industrial production, and a number of other sources by setting mandatory targets. This is a very bold step for a country to set mandatory reduction targets across the entire nation. And it was quite successful. Air pollution went down 30%, or in some regions higher in a few others. And we see that in the chart on the right, which depicts levels of SO2 and PM 2.5 declining over the period of the actual program, which lasted 5 years. And we see a corresponding reduction in mortality on top in the chart on the right from 2013 to 2017 in terms of mortality, and under that in years of life lost. So there's more to do here. This is not a perfect study, which these are sometimes called accountability studies. You know, we need to understand more about the role of economic activity. Was there a recession that caused these reductions in impacts, or was it really effective air quality management regulations? What was the role of meteorology? These are very challenging studies, but it's clear that this, I think, study is a really important first step in indicating that significant progress was made in China during this particular period. So finally, in conclusion, achieving air quality through effective air quality management is by any stretch a long-term commitment. Setting air quality standards relies on evidence from local and global studies and international assessments by WHO in different countries. Understanding emissions and exposures and at the regional and local levels are really key to setting targets based at the sources of greatest public concern, and frankly, making sure, as we heard earlier, that these solutions are cost effective, and they're really trying to reduce air pollution from the sources that will have the greatest impact on health. Assessing progress over time is really key to judging success. And finally, enhanced monitoring is needed across the board, basically to achieve all of the above steps. So thank you for your attention. It's been a pleasure.
When you're still there, perhaps there could be some quick question to Bob. Yes.
Thank you very much, Robert, and also Dr. Karidi, for those two great presentations. My name is Jerry Opondo. I work at the Environmental Compliance Institute, an NGO based in Nairobi. First is a quick story, and it relates to Robert's presentation in terms of evidence-based policy making for air quality management. And I want to tell you the story of East Africa, and Kenya for that matter. About a decade ago, air quality monitoring was virtually non-existent in most of East Africa. What evidence did we have for air pollution? We could see with our eyes, we could smell, and perhaps we could taste it. So that was our evidence. And for Kenya, we adopted a pragmatic kind of approach. And with that evidence, we embarked on developing our air quality regulations, as well as national ambient air quality standards, as far back as 2008. Now, the model you show about the key steps, is great. And I think at this point in time, based on the scientific evidence available, that would be the best way to go. At that point in time, what did we do? We looked at the WHO guidelines then. We looked at, say, South Africa, what do they have? We looked at similar kind of economies, Malaysia, Indonesia, and others, and looked at what they had set up as their ambient air quality standards. And magically, we were able to have our national ambient air quality standards. It's very interesting what Dr. Kariti presents, that, Kenya has achieved, some level of reduction in PM 2.5 concentrations. I don't know whether this is attributable to these standards or to some other actions, but somehow this approach is one approach that for us who work in this policy space, we have over the years advocated for countries and cities that do not have the level of scientific evidence that air quality monitoring can achieve. End of the story. So my question is to both Dr. Karidi and to Robert. I mean, for politicians who usually are the ones in charge of air quality policy making, and I'm glad we have Josephine here who is a politician. What is your experience with communicating, some of these beautiful graphs and charts for them, the politicians, to come to that understanding where they're able to say, we actually need to take action? Thank you.
Sure. Thank you for your story. I have to say that you've reminded me that I've left out a key part of my presentation, the role of magic. So thank you for mentioning that. I'll do better next time. I think the blue skies approach, I think visibility and identifying the fact that people can see air pollution is brilliant and critical, because bringing along the public is absolutely key, because that helps, of course, influence our dear politicians and their constituencies. So that's great. China did that with their Blue Sky program. I think that was how they described this in the early days. As Karidi pointed out, at some point air pollution becomes invisible as we make progress. And then it becomes, well, gee, it's still affecting public health. There's still more work to do. And that, I think, really underscores the need for science and local studies that demonstrate the effect of air pollution on asthma, so people can understand that, if their child has an asthma attack, air pollution could play a role, and it personalizes air pollution. So I think that's really important as well. And the third piece is, we've seen in different places around the world that at some point, usually when sources don't want to reduce anymore, because at some point it becomes challenging, there becomes a discussion of, gee, it's not my source that's impacting health, it's another source. It's not vehicles, it's stationary sources. And so having evidence that links specific health impacts to specific air pollution to specific health impacts becomes, I think, really key. So, yeah, Karidi.
Okay, maybe Karidi can add to that. And yeah.
So I just want to give a very practical follow-on to that, what you were saying. So I work as a scientist, but I serve my country and I work hand in hand with my government. So I have the National Ambient Air Quality Officer's WhatsApp on my phone, and we communicate regularly. And I think that is something that we're often missing in this puzzle, that we are not connecting directly with the people who need the information. And it's all very well producing an academic report or manuscripts, but if you don't make that meaningful and translate it into something that a policymaker or a decision maker can grasp and use, it means nothing at the end of the day. So we work on the principle of open and transparent, and so anytime I produce a new manuscript, I usually let the Department of Health and the National Department of Environment know. Sometimes we do a press release. I actually recently did one and I made a mistake because I didn't let them know ahead of the press release. And the Air Quality Officer, National Air Quality Officer, was very annoyed at me because obviously it comes out saying it was about orofacial cleft lip and palates being associated with maternal mother exposure to air pollution. And they wanted to know ahead of time, so I had to apologize and we did a statement together. But we have to be conscious that if you don't know who the people are working in your government or the NGOs, I mean, they play an incredibly important role. We have to think more broadly and be partners and collaborators in this exercise to really make a difference. And so I think in answering what you were saying, if you don't have those relationships, we aren't going to get anywhere. Thanks.
Relationships are very important. And I want to hear from the Ethiopian experience, Professor Kmir.
Thank you, Robert. I think the biggest challenge is in terms of setting the standards. We know many of African nations are very much struggling with poverty. And this means they have got other pressing issues, other important issues, like food security, like access to safe water, and so on. And therefore, they don't really push very much on the air pollution because of these pressing issues. But otherwise, generating evidence, use of air pollution measurement is critical, which we have to do. And thanks to NIH and our collaborators from the US universities, John Summit and Professor Kiros, we have air monitoring stations in 4 capital cities of Uganda, Ethiopia, Kenya, and Kigali or Rwanda. So that's really very useful, and we try to show them, I mean, the pattern and trends of what we have measured for the last 5-6 years, and that's really wonderful. But my question is, I mean, when we are having such monitoring stations, it's just only localized in one station, in one place. It doesn't cover really much of the other sites. And therefore, in that really vacuum, we need to use some kind of satellite-based data. And we know satellite-based data or low-cost sensors are limited in terms of accuracy and so on. So what's your advice in terms of using the satellite data, and perhaps develop knowledge through master's training, through PhD trainings, and get engaged in terms of showing the risks and so on? What's your review? What would you advise us? Thank you.
Thank you, Abera. Any experiences from Uganda? Can we hear anything? Gilbert?
Thank you very much. My name is Gabriel Okello. I'm from the African Center for Clean Air and the University of Cambridge. According to the Ugandan experience, I think one of the key aspects has been to try and break the siloed approach, to try and break the siloed approach and deliberately and intentionally work together with the various actors. I know this has taken a bit of time, and as you said, relationships sometimes take time. They are not as easy or as simple as the word itself. You have to understand the various pressure points of the different stakeholders. The Kampala City Council Authority representatives are here. They also have different pressures besides air quality. And this is a thing that I've always tried to put forward when I'm discussing with the various stakeholders. How better can we from the academia propose air pollution? And I think the gentleman from the Stockholm Environment Institute mentioned it properly. We have to try and bridge that disconnect between air pollution and health. We have to bridge it. From the society point of view, we have health practitioners who are well trusted within society, one of the most trusted group of people within society. So how have we utilized the health practitioners? We have the schools, the youth. How have we utilized the communication with the youth in trying to disseminate this information? Good enough, we've had AirQo come in and provide low-cost sensors that are helping in providing evidence on the state of ambient air quality. We have the National Environment Institute that have also been very instrumental in setting up the draft for the air quality regulations. So from my lens, from my point of view, I think Uganda is on the right path. As Keith said, there are no shortcuts. It's a marathon, but I think we should always celebrate the small wins, like this workshop. We should celebrate the small wins where we come together and share ideas and come up with tangible actions in order to improve air quality. Thank you.
Thank you very much, Gabriel, right?
Yes.
Yeah, thank you. And of course, we build on this one and the workshop next week in Kampala as well. Okay, so maybe before I get to you, there were some questions from those who are joining us virtually, and there are a couple of questions that we need to address. One is from Nasiku. Nasiku is asking a question specifically to Karadi, and the question is this: your opinion on state of research on health effects of household air pollution in Africa. Do you have an opinion on that?
That is a really big question to try and answer in 1 minute. But I'd like to say that we have made some progress in that. I know of many studies. Most of them are cross-sectional type epidemiological studies, as well as qualitative work, which we shouldn't disregard. But I think what might be missing is the more sophisticated type of studies, like cohort studies and so on, so that we can get a better idea of the baseline situation in some of our African countries in relation to household air pollution. But at the same time, I have to say that the time for understanding what the impacts are is kind of passing us, because we should really be moving towards interventions to solve the problem. So it's all well and good to say, yes, we must know what it's like in our own country. I know my government does that to me all the time. They don't want to know the evidence from somewhere else. They want it here. But if you do a study to find the evidence, it can't stop there. You have to do the implementation science and intervene to try and improve people's health.
Great, thank you very much. And a second question to you from Radwane, and this is the question. How can health effects of air pollution be evaluated in areas where data are limited, especially clinical data?
Yeah, so that is a really challenging question, because we know that in many of our facilities, our healthcare facilities, data are not electronic or digital. They're often written by hand, and it's a very data and laborious, intensive task to try and extract those data, but it is not impossible. So with a lot of effort, it is possible to go and get those data, but more importantly, I think we should be advocating or lobbying for a different way of collecting those data to make them more accessible for research, to be able to inform, especially the interventions. If we want to know if the interventions have an impact, we need those data. And there is a place for all of us to advocate for change in data collection.
Kiros or John, do you have an opinion on this?
I thought you had an opinion. So, I was actually going to make a more general comment that maybe something we ought to discuss over the next couple of days, which is the need for local data. And looking around the room, I don't think that your lungs are different whether you're from the United States, Kenya, or Uganda. And I don't think a dirty, polluting vehicle spewing out black diesel exhaust is different in Kampala or in Nairobi. So I think we have to be a little bit careful and not say we must have exact local data to convince people that action is needed. And, for example, the WHO air quality guidelines with Cardi and I have worked on for countless years. Those are based on all the science. And I think we just have to be careful. So I understand the need for local data sometimes. I think the health impact assessment is actually a bridge from what we know to trying to make things local for policy purposes. So to say, yeah, here's what we know in general, and then if we apply that to Nairobi, here's the burden of disease that we can attack. So that's my general comment. I think it's something we should talk about, because I don't want to say that every single city has to have a time series study done, or every country. So I think we should talk about this a little bit, about what kind of evidence will make a difference in different policy contexts.
Yeah, just to add a little bit to that, actually, I think, local data has a lot of value, but we don't have to reinvent the wheel. In fact, it could be done smartly by being complementary. Like for instance, lung might be the same everywhere, and ambient air pollution effect has been demonstrated. But in the African context, you have the cultural context, and also you have the indoor versus outdoor contributions that are unique, right? So research could focus on those complementary areas in a very strategic way so that you're not repeating what everyone has done, but you're adding value. At the same time, creating or developing local evidence so that the politicians could actually at least don't have any way out of actually implementing air pollution standards and regulations.
I would agree with that. Quick response to that. I would agree with that. And when we think about local data, we usually think about conducting representative studies, not exactly as you said, reinventing the wheel in every particular location to understand extrapolation. And it becomes really important, I think, for air quality management to identify key sources and geographies in different regions, not necessarily for setting standards. So there's a value there. And there is one study, one comment, story that I'll pass on from India, when it came down to regulating mobile sources, particular vehicles, and the industrial representative at the time stood up and said, yes, there's all this international evidence, but Indian lungs are different. They're not sensitive to air pollution because they've been exposed to it for so long. So there's really no need for air pollution here. And the studies aren't relevant. So the representative studies are key, and it's not reinventing the wheel, but it's got its place, I think.
Yeah, thank you very much, Bob, for that addition as well, Kyrus and John too. And another question from those who are joining us virtually. Jakim is asking, policies to address natural resources like sea spray, desert dust, and wildfires. Do you have, any experience or information around policies that address those kind of natural resources, other than just anthropogenic? And perhaps Bob, you want to give it a go? Do we have policies, or are you aware of any policies, or can we generate policies to address natural sources of air pollution, such as desert dust and wildfires?
Yeah, natural sources are challenging in particular parts of the world. There's two answers to that, I guess, and I'm sure others have opinions. There's very basic types of control measures, street sweeping and things like that, which pick up also toxins from, or pollutants from vehicles. But there's also reductions in anthropogenic air pollutants that can attach pollutants to wind-blown dusts and make them more toxic than they otherwise would be. So one part of addressing, I think, dusts is ensuring that anthropogenic emissions are also reduced to reduce the toxicity of the dust.
This is a quick comment, and Karita, you may want to comment. When we did the WHO air quality guidelines, there was a lot of interest in the desert dust issue from our colleagues in the Middle East, and that part of the world where they of course experience at times tremendously high levels of airborne dust. WHO is doing a review, and we heard about the progress on that maybe 2 or 3 weeks ago. And it's an example of a problem. And of course, for the wildfire smoke in the part of the United States where I live, we've had a lot of issues with wildfires, sometimes with several months of high PM 2.5 levels. And we don't really have a policy. It's not covered by our air quality regulations, and where we are trying to do things, it's more about protection of people and vulnerable people at times when the levels of wildfire smoke may reach hundreds of micrograms per cubic meter of PM 2.5, and whether, for example, providing N95 respirators can be helpful, but we're not very good at doing that in the United States.
Yeah, thank you, John. That's a great contribution to that. So natural sources still difficult to develop policies around. And maybe as we come to a close to this session, we there was a challenge that politicians need to do something. So I'm challenging a politician to do something about responding to Gerrit's question.
Thank you, Jerry. I was responding to you specifically. As politicians, summarizing the much we normally have to that very little that can be given to this audience, it's also another challenge. But what we did way back in Uganda or in Kampala, at KCCA where I originate, we had to break the silos. Working in what? In silos. So who is the stakeholder in this? We are all stakeholders. As a politician, my role is to go alongside the policy making. I have to go back to that community which entrusted me with my voice. How will I sensitize them? When I'm here, I'm learning. I have to break it to the smallest language they can understand. Tell them about the air pollution and how they're affected. So that is how big we are playing in this role of air pollution. Thanks to my team from KCCA, back in Kampala, they interested me, the only politician who is an ambassador for air pollution.
Let's clap for Thank you, thank you. Now, we've had, a fantastic keynote session, and Karadi gave us a lot of evidence on, health impacts of air pollution, but also resources on where we can get such information, and that was very well taken. Thank you very much on that. And Bob also gave us how we can develop standards and some of the issues that we need to do, determining health hazards from exposure, at what exposure level do effects occur, and how can we test which sources contribute to health hazards. And he also suggested that China has a great model that we can potentially use. So I'd like you to join me in thanking Karadi and Bob for a fantastic presentation, but also to thank you for your contributions during this session. So we can break for tea, coffee, juice, and let's come back here at 11:25. I'll ask Lydia to be the timekeeper and ensure that everybody's back here by 11:25. Thank you. Enjoy your coffee, tea break. Okay, since you are still dilly-dallying, I have another request. Can you clap for me?